Good morning all. My topic is on accommodative disorders in non-presbyopic subject with type 1 diabetes without diabetic retinopathy. According to WHO, India today hits the world with over 32 million diabetic patients, and this number is projected to increase to 79.4 million by the year 2030. Recent surveys indicates that diabetes now affects a staggering 10 to 16% of urban population and 5 to 8% of rural population in India. At the ocular level, diabetes can affect practically all ocular structure. In anterior segment, complication includes corneal dysfunction, abnormal corneal sensitivity, diabetic keratopathy, progressive decrease in density, alteration of the corneal nerve, and clouding of the lens at an early age. In the posterior segment, patients with diabetes can experience diabetic retinopathy, neuropathy, glaucoma, and macular edema. Aim was to assess accommodative function in non-presbyopic with type 1 diabetes mellitus. This study was observational, cross-sectional study. Duration was from September 2023 to August 2024. Total sample size was 24%, 12 diabetic and 12 non-diabetic. This was conducted in OPD, Rio Rims, Ranchi. Demographic details, uncorrected visual acuity, best corrected visual acuity, accommodative examination, ocular examination, personal history, drug history, medical history, and surgical history were noted down after taking consent from patient. Template was generated using MS Excel sheet, and data were analyzed using SPSS software version 23. Table 1 is showing demographic details of diabetic and non-diabetic groups, where we can see all parameters were equally sensitive. Table 2 is showing ocular examination of patient. Table 3 is showing accommodative variable and classification of the subject according to normality value. Amplitude of accommodation in a right eye is 7.32 plus minus 2.64 in right eye. In left eye, it was 7.65 plus minus 2.64. In non-diabetic group, it is 9.90 plus minus 2.40 in right eye, 9.96 plus minus 2.28 in left eye. Accommodative facility in diabetic group was 7.05 plus minus 4.92 in left eye. In right eye, it was 7.54 plus minus 5.16. Both eye, it was 7 plus 9.39. In non-diabetic group, it is 11.13 plus minus 3.93. In right eye, 11.07 plus minus 4.14. In left eye, 10.75 plus minus 3.59 in both eye. NRA was 2.45 plus minus 0.45 in diabetic group, and it was 2.40 plus minus 0.44 in a non-diabetic group. These findings indicate that type 1 diabetes mellitus impacts the majority of the parameter used to evaluate accommodative function. The amplitude of accommodation and accommodative facility were significantly reduced, while negative relative accommodation was higher in the type 1 diabetes population than in the non-diabetic group. The diabetic group exhibited more accommodative insufficiency compared to the non-diabetic group. A relationship was observed between the duration of the diabetes and amplitude of accommodation, accommodative facility, and negative relative accommodation, but no such relationship was found with HbA1c levels. These are the references. Thank you.
Thank you, Dr. Rashmi. So it was a cross-sectional study or a comparative study?
It was a cross-sectional study.
Okay. So cross-sectional only for non-presbyopic type 1 diabetes,
Yes,
right?
Very interesting findings. You are suggesting that the accommodation amplitude as well as the accommodative factors are related, are associated with duration of diabetes, but not with HbA1c levels. So not with the control of the disease, but with the duration of the disease.
Yes, sir.
So basically, normally what we do is we say that, duration of disease, the microangiopathy and the neuropathy, so probably some interplay is going on there. So probably you need to look at it more. Interesting study, interesting findings, uh, but more work required. Nice study.
Thank you, sir.